Welcome to City Chat with City Magazine. I'm Kylie Dobeguy, General Manager of City Magazine, and today we're chatting with Dr. Joel Roloff of Adjust Life Chiropractic.
Hello, Kylie.
Good morning. How are you doing today?
Very, very well.
So I'm going to throw a bunch of oddball questions at you. Softball is in full swing. What
No pun intended there.
Yeah. Oh, wow. I didn't even think of that. What is some of the advice that you can give to people who are playing softball to prevent injuries?
Oh, that's a good question.
Thanks.
Just to prevent injuries, I mean, warming up, I always say, is a good thing, and drinking a ton of water, because you end up drinking other things before and after softball that really don't help the whole getting injured thing. And warming up doesn't need to be stretching. Sometimes you can stretch too much and cause some problems. But going for a nice jog, doing something, when you're out tailgating, maybe go for a light jog around the truck and just make your rounds to other groups. That might be a good thing. And the biggest thing after you play softball is to just refuel yourself. Get some good stuff inside you. Like some raisins are always good. And I always say spinach is the best thing, but who's going to bring spinach to a softball field?
Yeah.
So bring some trail mix, some nuts and raisins to really help put some good stuff, some good fiber, some good sugars back in your system.
Well, let's talk a little bit about chiropractic care.
Sure.
Who are the people that need chiropractic care?
If you have a spine, you probably need chiropractic care.
Okay, so basically the whole human race.
Yeah, if you back when we were cavemen, you didn't need a dentist because you didn't eat the way we do, and you didn't need a chiropractor because you don't move the way we do now. So now that people have a lot of office jobs and they don't move like they used to, like we're supposed to, people's spines stop moving. And when you stop moving, you stop living, and that's not a good thing. Most people come in when they're in pain, obviously, because that makes the most sense. If I can't play softball, then I'll come in and see what's going on. But, when people start feeling better, they realize, holy cow, I'm supposed to feel good all the time? That's amazing. And then they decide, then they come in and make sure they're taken care of. So, we see my youngest patient was a premature baby, and my oldest patient is 86.
Wow.
So anywhere and everywhere, chiropractic really helps them out, especially if you're sitting for 8 hours a day.
What are the top 3 reasons why somebody would come in for chiropractic care? I mean, what has been the biggest complaints, I guess, that you've noticed?
Pain, and pain.
Oh,
those
okay.
are the biggest. So it's chiropractic. You can look at it on the surface as it's I'm getting people out of pain, but they've actually done studies, and they did a study at a headache clinic, and they asked people, how long have you been dealing with your headaches before you decide to come in for care? And so go ahead and throw out an answer, Kai. What do you think?
How long they decided to go without care?
Yeah, how long are those headaches going on?
5 years.
Most people say like 5 weeks or 6 weeks. But yeah, it was 7 years. 7 years they waited. And they didn't come in for care until they were unable to do something they loved in their life. So if they can't swing a golf club, then they'll come in for care. If they can't, talk to their husbands or wives without feeling this pain in their head.
Well, I think that's everybody, actually.
Well, that's sometimes you can fix that with duct tape, but
exactly that too.
But if you can't, that's when they come in for care. So not only are we making people feel better, but we're helping them live their lives, and that's why it's the most fun.
So at Adjust Life, you don't just do chiropractic care; you really look at the full gamut.
Yeah, definitely. Because if you get people to come in and you take care of them and you send them back to do whatever they did that brought them there in the first place, are you really helping them a whole lot? Yeah, you're getting them out of pain. Yeah, you're making them feel better. But go back to the office. They do those things. They don't sit better. They don't type better. They go back to their lives. They don't eat better. Mm-hmm. They're going to be, they're going to come back and they're not really going to truly get better. And so we go through everything. We always address all the aspects of health.
Yeah, I know. Side note here, I've been going to Dr. Joel for a couple of months now, and I was having headaches, like he was saying, and I have like this really weird thing where my ears get plugged up. And he adjusted my ears the first couple times, like, okay, what the heck is he doing? But afterwards, I mean, like, my ears don't plug up hardly ever, and it's just, I love my go monthly to him. I always need it every month at the same time.
Yeah, you do.
I do. He knows I'm bad. A lot of misconception out there. Is chiropractic care really expensive?
No. Oh, and I don't want to say it's it's cheap, but they've done. I'll bring out studies, and I'll keep doing that. But they put people who are in pain, with work comp cases, and other problems where it's regulated, and they'll put you in with. Or they've seen people who are just seeing chiropractors, who are just seeing medical doctors, who are seeing both. And chiropractic was about a quarter to half that of medical doctors, and about an eighth that of chiropractic and MDs. When they pass you around the system, patients. So it's always the last place people go when they're in pain or have problems. So that's when I see my patients. But it should actually be the first place they go. It's the most cost effective, we'll say, and it's the safest. And then you're not going to be on some sort of medication or something that you may or may not feel comfortable taking.
So it's 255-5000.
Yep.
So give Dr. Joel a call for your next appointment. And thank you very much.
You are welcome.